What I want to talk to you today in the few minutes we have is just what we're doing here in the HSE. The development of integrated care aims to join up health and social care services to improve quality and put patient outcomes and experiences at the centre of everything we do. To enable people with complex needs to lead healthier and more independent lives and to lead the best life they can. And so the Patient Narrative Project was initiated within the Clinical Strategy and Programme Division, and the purpose of it was to have something, the patient voice, that would drive integrated care, that it would be central to how we design and deliver integrated care programmes. And of course, the integrated care programme for older people is one of those. I suppose what this slide shows is our journey to date. And this is only one of the roads that will bring us or help us to progress along what seems to be, what will be, I think, a long journey towards really putting patients as partners or seeing patient service users as partners with health service staff in designing and improving services. I suppose the start point for us was very much around, if we want to develop person-centred coordinated services, how do we do that? What does that mean for people? What does that mean for people in Ireland who use our health services? And so the first piece of work that we looked at was trying to describe and define in really concrete terms that frontline staff, middle-level staff, patients, service users, and people at the top could, tangible things that they could see happening that would mean we were on our journey in person-centred coordinated care. In order to do that, IPOSI, the Irish Platform for Patient Organisation, Science and Industry, joined with ourselves and UCD to look at a piece of research that would tell us what was important to people in Ireland in health services. So there were 4 regional workshops, 11 focus groups and 2 online surveys. And what we heard from that was that really what's important could be distilled down into 18 statements and 1 definition. I'm not going to read through all of the statements now, but really, I suppose, what we heard from people who were involved was that you want a health service that treats each person as an individual, that is flexible enough to provide the care you need where and when you need it. You want to be informed about your health so that you can play an active role in it. You want to be treated as an individual and not as a health condition. You want healthcare staff to think about your whole world, not just your medical needs, but you within the context of the important people in your life, your everyday activities and responsibilities, your values, your hopes for the future. And you want the healthcare staff to live the values of the HSE, care, compassion, trust and learning as they go about their work. In summary, you really want all elements of your healthcare and your world to be connected with you actively involved in it. And what we called this was person-centred coordinated care. And I suppose that's all fine, and often it's quite lofty, and we need to see how can we actually move to providing care or working towards the experience that people have of care being like that. And that's where we're looking at Your Voice Matters. So Your Voice Matters is an online survey, paper survey or smartphone app, which really looks and asks the question of how far, where we are in our journey towards person-centred coordinated care. Okay. And I suppose very much from what Annie was saying earlier, it is that piece of how do we pull together the statistics that are so important to so many people who make decisions in health services, but also keep there at the core of all of that the real experiences of people who are attending services on a daily basis. I suppose what we have looked at is using a piece of software called SenseMaker within the Your Voice Matters survey. The survey itself asks you to tell your story, to tell your experience, to tell it in your words. No one can say it didn't happen. It's your words, it's your experience. And then to think about that experience in comparison to what you said was important for person-centred coordinated care. And these are some of the information or the data that we've received from the Your Voice Matters to date. At the moment, there are over 400 contributions have been made to the survey. And I can tell you that 25% of those are from people who are 65 or older. either independently making those contributions or making those or someone else making those on behalf of them. And I don't know if you can read this, but these are some examples. So the first question asks, in this experience, I was treated as a human being, a burden, or a number. And people are asked to place their dot in the part of the triangle that most represents how they felt in the experience. And what we can look at then is each of those dots is a real person, and their story is there behind that dot. So for one individual who placed the dot at a human being, what they told us was that the elderly relative that they were writing the story on behalf of, what they say is, but most wonderfully, they met her in her home. She was so relaxed in her own environment that they succeeded in conducting a more realistic assessment. And I suppose that was about older persons' care in an area of the country where the individual was seen at home, where she could be seen for who she was and at her best. Also, I suppose another one from being treated as a human being, someone says, I found the service very good and the staff very concerned and very informative. I was briefed all the way about what was to happen and what to do post-procedure. The importance of being told the now and the next, the importance of knowing what's going to happen and being kept informed in a way that the person understands. But we also have the stuff that's harder to listen to. And we can see what it means when we have a dot where someone says they were felt as a burden. So it says the staff member was insensitive, curt, non-informative and lacked compassion to me. Simply told me the diagnosis but offered no explanation. I was so upset and lacked information regarding the condition. Okay? And that's hard to listen to, but yet that is how someone felt in the experience. And someone who felt they were treated as a number, I was put on a never-ending waiting list and told I wasn't a priority. This service is vital to me. And I suppose what Your Voice Matters allows us to do, not only to see the person behind the statistics, but it allows us to see the perspective, to see the health services and the experience people have from the perspective of the people who are having those experiences. And when we look at something differently, or when we look at it from a different perspective, it really changes what we see. And what we need to do then with the output of this data, or the output of the survey, is to look at how we can make improvements both at national and local levels in integrated care so that things are better for people, that their experience is better. I suppose what I would ask then just for today is that we have, I know, say 25% of people who have contributed so far, people from the older 65 and over. We certainly have set up stations outside with laptops. There's hard copies of the survey and people can contribute to it at this stage. The pilot will run until the end of, or the 6th of November. And what's important is, I suppose Annie was talking about it as well, what's important is that that information is going to be looked at together by staff and service users and patients, and together decide what priorities are important for them, so that it's not about that bit of let's hear your stories and then we'll tell you what's important. But it's that piece of coming together and working together. We definitely have a long way to go in the journey. Your Voice Matters is one way of supporting us to get there. It is only one little bit of the road, but it certainly will help us to begin to see things very differently from the health service perspective. Thank you.